Hi, everyone. I want to welcome you to the annual Careers in Public Health panel. My name is Elisa Crossman, and I'm an undergraduate advisor in the Herbert Wertheim School of Public Health and Human Longevity Science. Tonight, we will hear perspectives from 4 professionals working in various careers within the field of public health. I want to encourage you to use their answers as a starting point for your journey into researching the graduate programs and career paths that are the best fit for you. For more information about graduate school and careers in public health, visit the Planning Your Future in Public Health tab at ph.ucsd.edu/undergrad. I want to remind you that today's event will be recorded and will be available on the public health website following the event. Our panelist information and contacts can also be found on our website tomorrow on our news and workshops pages. Now, I'd like to ask our panelists to introduce themselves. Please tell us your name, your degree, area of focus in public health, workplace, and position. Kevin, can I ask you to get us started?
Sure. Thanks so much for having me today. I'm very excited to be here. My name is Kevin Sue. I graduated from UCSD in 2004, which I was just reminded of by the big screen on the top that it's been 20 years, which is a little bit scary for me because it doesn't feel like it was that long ago. But there was no School of Public Health at UCSD when I graduated, so I'm very excited for all of you to have the opportunity to get to study public health in your time at UCSD. So like I said, I graduated at UCSD in 2004 with majors in ethics studies and political science. I graduated. I then went to law school. I actually have a JD. I tell people I'm a recovering lawyer because I'm not practicing anymore. Worked for a couple of years as an attorney, civil rights attorney in New York City. And then after that, and actually because of that work that I was doing in New York City, decided to go into public health. And maybe I'll talk a little bit more about that later, and went back and got my master's in public health from the Harvard School of Public Health, and have been working for the federal government, for the U.S. Department of Health and Human Services as a lead public health analyst in the Bureau of Primary Healthcare, where I work with the Health Center program. We provide primary and preventive healthcare to all people, regardless of ability to pay, to about 30 million Americans right now. About 1 in every 11 Medicaid patients get their healthcare at a health center. We have over 1,400 health centers in all 50 states, in all the US territories as well. And I've been there for about almost 14 years now. So it's an amazing job. I'm happy to talk more about working as a civil servant for the federal government as well. And yeah, just really happy to be here. Thanks.
Great, thank you. Kat.
Hi, everyone. Good evening. My name is Kat Briggs. I use she, her, they pronouns. It's really a joy to join you all in this virtual space this evening. I work for the County of San Diego's Health and Human Services Agency. I've done so since about 2010. In a variety of departments within our Health and Human Services Agency, but currently I'm the chief of our communication and engagement team at County Behavioral Health Services. In most of my time at the county, held a public health related role or position, in particular, probably I'd say in the behavioral health, health services, health science kind of capacity. So look forward to kind of sharing anything I can from my perspective. I started with the county as a student worker, and so I love getting to connect with students near and far. So really appreciate this opportunity this evening. And so similar to Kevin, kind of work in the public sphere, but kind of locally here. So your local government health organization. But with that, Lisa, I don't know who to popcorn to.
That's perfect. Thank you. Amy.
Great. Hi, I'm Amy Abrams. Really happy to be here as well. I am a UCSD alum, but from the ancient times, I got my bachelor's degrees there in 1997. I double majored in sociology and women's studies, well before there was a School of Public Health. I went on to San Diego State to pursue a joint Master of Social Work and Master of Public Health degree, which I finished slowly. I finished in 2005. So I kind of backed into public health. I got my training in my 20s and then worked primarily as a clinical social worker for the early part of my career. My interest has always been in health and aging. Specifically, my degree in social work was a concentration in health and aging. My degree in public health focused on health services administration. And the issues of growing older and taking care of oneself and other people that are growing older has always been my work. I worked again in clinical social work as a care manager and in the fields of home care and medical social work for 10, 15 years. And then shifted into, I started getting a little itchy to get in touch with my public health side. Went to work for a nonprofit. This has all been here in San Diego County. Went to work for a nonprofit running the community health education programs for a dementia support organization. Did that for many years. And in 2022, joined the team of the Grossmont Healthcare District. So this is where I really get to put on I firmly put on the public health hat. I'm the chief community health officer there, and I oversee the healthcare district's community health initiatives. So we're also government. We're as small and hyper local as government gets. We're a special district. We have about 500,000 constituents, all in the eastern region of San Diego County. So a small portion of their tax dollars goes to our agency, and we reinvest that in community health initiatives. So I oversee all of those various initiatives there.
Great, thank you. And Lauren, I know that you've been on our panel in the past, and the last time we had like a super heavy panel on digital health. This time we don't. So please introduce yourself.
Sure. Yes, so I'm Lauren. Excited to be here sharing with you today. I got my bachelor's in public health and psychology out in Boston at Tufts University. And then I worked in clinical research for about 4 years. I knew I wanted to go back to school, but I wanted to save some money and get some more experience and just ensure that I was really committed to a research path. I went to UCSD, the joint doctoral program in public health between UCSD and San Diego State, and focused on health behavior, and graduated in 2021 and went straight into working in the digital health sector. So I've worked at 2 different startups, both focused on digital behavioral health, and I'm currently working at a really small company. We're less than 10 people. I'm the director of clinical science, so I direct all of our clinical research, work with partners. I also get to use my behavior change and health behavior experience and formal training to make our product more engaging for users and more evidence-based. So we develop a digital health platform to support patients and their therapists or health coaches, and I'm happy to talk more about that as well. And the company's based in Oregon, but I'm still in San Diego because it's really hard to leave.
Thank you. And why don't you get us started? Maybe tell us a little bit about why you chose your career in public health and kind of what drew you to this field. What do you feel passionate about with public health? Things that really made it click.
Totally. So I actually chose my undergrad school because they're really renowned for their international relations program. And so I was really involved in social justice issues in high school. And that was something that was really important to me. But my very first class on my very first day was Intro to Community Health. And I never looked back. I never even took a political science class. I totally changed my trajectory because I realized that I felt that people couldn't fully participate and contribute, to civic society if they weren't healthy. So it really came down to that for me. And at my university, like many of you, there was not a public health program as a primary major at the time that I was there. So I had to pick something else to go with it. And I was really fascinated by human behavior, how people could shape their own health. And so that really drew me to the health behavior segment of public health. When I was in grad school, I was working a lot on research using technology. I worked with the Cancer Center with Dr. Hartman, who many of you might have. She's teaching 2 sections of health behavior right now. And she uses technology in her research to make interventions more scalable and to help evidence-based interventions reach more people. So to me, that's kind of the public health impact, is being able to take things that work and bring them to more people, increase access, etc. I think that answers your question. I want to hear what others have to say.
Thank you. That's great. Kat, can you tell us a little bit about what drew you to your career in public health?
Yeah, sure. So I will start with, I found public health very late, I think, in my undergraduate career. At least I would say so. It was it's my last year before graduation. At the time, I originally was going to school for occupational therapy. And so I was a kinesiology pre-therapy major. And actually I had an elective class just by happenstance that was kind of more of a intro health science, health promotion focus. And similarly, I think to as Lauren just shared, I'd never heard of health in that context. I'd always thought of health in sort of the relationship more one-to-one, a clinician or a provider and the patient. And so hearing being able to be more preventative, less reactive, if possible, being able to treat groups of individuals, that was kind of a huge draw for me. I had at the time also been, I call it the summer of a million internships. I was interning everywhere, the majority of which were kind of more clinical positions. Chiropractor's office. Actually, I was part-time doing working as a certified nursing assistant as well. I had a clinical internship with Palomar Pomerado Health at the time. I have a huge family of health professionals, whether those be radiologists, nurses, physicians assistants, etc. So again, my definition of a health profession from very early on for a very long time had been more of that clinical or medical definition. And so when I took that class and started hearing about, I'd always loved sociology as well. That had almost been my undergraduate major. And so when I was listening to why people might engage in certain behaviors that would impact their health, coupled with this is another way to help individuals and families and groups of people, hopefully before they get sick. Those are huge draws. And I think at my core, I till this day still say that I'm kind of an educator at heart, and in particular educating around health literacy and developing folks' health literacy. Did a lot of communication before my time at the county. And so it's been nice to sort of bridge that world with different health topics and things that, whether it's chronic disease prevention, or in the case of behavioral health, substance use prevention, or addressing mitigating risk factors for mental health challenges. Again, all of that, it's just been really great to try and get ahead upstream of things and see how I can help folks ahead of time. But it was really, I think, a lot of opening and closing of doors in one particular summer, because I was very motivated, about to graduate, and still felt a little lost, quite frankly, and was like, okay, I need to kind of I've seen enough of this in classrooms and on books, and I need to talk to more humans and like get out there and see what it looks like. And the chiropractor door was not my door. The nursing door was not my door. And then I came to find that public health and health science was definitely the door. So, but I'll leave it there.
I love the door analogy. That's so great. Kevin and Amy, I know you both had kind of other things that you had started your careers doing. Maybe Kevin, do you want to get us started? And then Amy, you can share as well. What drove you to change into a career in public health? What kind of made you go, oh, this is what I actually want to do?
Right. I mean, I didn't study public health in undergrad. As I said, there wasn't any, right? There wasn't any public health. I think the closest I came was a political science class on the city, right? It was more of an urban study, urban design class. And when I was an undergrad, I really knew I wanted to go to law school. I was really interested in civil rights law, and that was really what I was passionate about. I was an ethnic studies double major. That was really driving me in terms of all of my focus. And then I got into law school. I studied civil rights law. I did all the things that I was supposed to do. I got this great job working in civil rights law in New York City after law school, and I was working there for a couple of years. And while I was there, I was at a very small nonprofit civil rights organization that did both advocacy and communications work. And I was working with our research director, and he was doing research in East New York, in Brooklyn, which was at the time and still is predominantly Black neighborhood with very high rates of poverty, very high incidence of various medical conditions, asthma, etc. And I started working with him with this community, and they were doing some organizing work. They were doing some work around a hospital closing in the area. And I began to realize that public health work is civil rights work. And that's really where the connection happened for me. I realized that, you know, all of these other civil rights issues that I was interested in at their core relied on people being healthy enough to be able to take advantage of other opportunities. And yeah, I really just had this shift where I was like, oh, by doing research work, by doing public policy work, I can have as much or more of an impact in the lives of these folks whose civil rights are often not honored or often not able to be exercised, in part because we have honestly, you know, a pretty messed up healthcare system in the country, and there's a lot of people who fall through the gaps. And so I went back. I got my master's in public health, worked with some really amazing people, and got to study with some really amazing people. I got to do a internship at the Massachusetts Department of Public Health, and then got this job working with HHS afterwards. And yeah, I haven't looked back. I mean, I haven't regretted it at all. And I guess the other thing I'll add to that, and I'll pop it over to Amy, was just that it's okay to not know exactly what you want to do when you're in your 20s. I mean, I was very sure that I was going to be an attorney. I really knew very clearly what I was going to do. And then, you know, 5 years after I graduated college, completely changed my mind and did something completely different. And I had the flexibility to do that, and you all have the flexibility to do that too. So there's a lot of pressure, I think, even more so these days than when I was in school, to feel like you have to know exactly what you're going to do and how you're going to get there and have it all mapped out. And it's really not true. I mean, I know plenty of people, have other family members who did very major career shifts, and so it's definitely something where you have a chance, and I had a chance to explore and find exactly what I was really passionate about.
I say that to our students all the time. I just love hearing it on panels too. So thank you. And Amy.
Yeah, I love hearing it too. First of all, I don't work in a public health agency, so this is just so fun for me to get to hear from other people that care so deeply about this as well. And yeah, absolutely. I never could have imagined. I mean, literally, the role I'm in right now did not exist when I started my public health program, however many years ago that was. So I truly could not have imagined it. And my career continues to evolve. So as I mentioned, I started out as a social worker that also happened to have some additional training in public health. And I think I fashioned myself as somebody that was seeking a career in social work, working with older people. But as I started learning the philosophies of social work, you look at the person in their environment, right? You evaluate their strengths. You look at the system of things that surrounds them. It's not psychology where you focus on, you know, the thinking of the individual person. You're looking at the system around them and figuring out how to help them make that work better for them. And so in doing that, in particular, I was doing that focusing on older adults. To Kevin's point, our system is just, in particular, our long-term care system is just completely broken. It was when I was young in my career, and I'm sad to say I haven't made it better. It's not, I haven't fixed it. And so over the years, I really morphed into somebody that was focused on these individual people and helping them solve their individual access problems and issues of advanced care planning and all of the chronic disease and prevention and wellness and all of the things that go with that. Living with Alzheimer's disease in particular was a huge area of focus through most of my career. And over the years, that just shifted to trying to do something about the way people obtain health information, the way they use health information, and then of course the quality of the health information that's out there. And I think just it wasn't, it didn't suit me to go the policy route and try to do something about the structure of our healthcare system and fixing our long-term care system. There's smarter policy thinkers than me to do that work. Where I'm interested is in helping communities understand the system that they have and working as effectively within it as they can. So, you know, on the topic of careers going in unexpected directions, like Kat, I developed an interest in health literacy during the time I was working in community health education. Got real passionate on that topic, pursued a master's of library and information science that I'm just about complete with. 3 more units to go, you guys, 40 down, 3 to go. And got really, really invested in the world of public libraries in particular and consumer health librarianship, which today is a huge part of what I do in my role at the Grossmont Healthcare District. We operate a public library that is all consumer health information. So that's a big chunk of my work. Who would have ever seen that coming? Not me. So, yeah.
That is something that I never have actually heard was something that somebody could have as a career.
Yeah.
So now I know that I can talk to students about that as well. That's really
Yes.
great. I love it. All right, thank you. Amy, would you like to kind of talk to us about what your typical day might look like? I know this is something that is always a question for students because it's really hard to visualize sort of the difference between different types of, you know, public health careers.
Mhm.
Could you talk us through what a typical day or a typical week might look like?
Sure. Yeah, I'll have to be super abstract about it because probably like everyone else on this panel, it's like day to day, hour to hour, who who even knows? But big picture. So I work in a small public agency. I'm part of the executive team. So myself, the chief executive officer, and a chief administrative officer. That's my primary team, and then I support the community health team within our agency, which is the health communications, the library, the head librarian, and the library staff, and then our programs, community health programs and outreach arm. So that's my area of responsibility there. Some days I'm in my office and I'm, you know, meeting. That's lots of meetings because I support a pretty big team. Some days I'm out in the community. We cover an enormous area, 750 square miles of San Diego County. I do my best to at least once a week get out into a part of it that I don't know, you know, to try to meet people. I'm trying to understand those communities and talk to them. And then like the bulk of my work is taking information. So I work closely with the County of San Diego and Kat and her team, taking the information that they have as well as other data sources, looking at that and then trying to translate that into, you know, where are the gaps in my region. Right. There's clear gaps when it comes to access to behavioral health services, for example. We have an enormous swath of rural territory within my district. So addressing the rural health needs of the thousands of my constituents that live out there, dealing with, you know, trying to support telemedicine initiatives in an area that's got really horrible access to broadband and like no cell coverage. So trying to sort of take the data that's out there about we also own a hospital, failed to mention that, but the Sharp Grossmont Hospital is owned by the people of East County. It's a public hospital, and my agency owns it on behalf of the people of East County whose tax dollars pay for it. And then Sharp Healthcare is our operator. So I work with hospital administration and other, county entities, other agencies around my region of the county, the Eastern region, just to try to kind of match up what we're doing with what we're not doing, and supporting the nonprofit agencies and clinics, all the people on the ground doing the work within my region, working with them. We give community grants to nonprofits that are, focusing on our health priority areas, which are aging, behavioral health, and the 3 chronic diseases of stroke, heart disease, and cancer. So those are the highest causes of mortality within our region. So just kind of, and like what that actually looks like on a daily basis is basically talking to people all day long, program development, collection development in our library. We're building a mobile library to get resources out into the rural areas of the county where people are not going to, be able to come to our physical space. It's a lot of talking to people and bringing ideas to life, and providing funding, honestly, to nonprofits that need it to support my organization's mission.
Thank you.
Mhm.
Kat, can you tell us a little bit about your day-to-day, the types of things that you're going to be doing?
Yeah. Happy to gonna echo what Amy said. And Amy, it's always a pleasure to be in the same space as you. Amy and I mentioned I worked in different offices and departments of the county, and so during my time at our Aging and Independent Services department, had a lot of opportunity to cross thread with Amy then, and I'm now cross threading with her in our 2 roles now. So it's always a pleasure. In terms of day to day, it's very. I was just off to the side here looking at my calendar the last 3 weeks to see just, what should I share? And every day and every week is just very different. And I'm seeing my colleagues here smiling. Again, I think that's one thing that I personally actually really enjoy about the field of public health. It is multidisciplinary. You're working with, on one day, maybe community members, on another day, perhaps businesses, on another day, more perhaps internally. So every day is different. My particular role currently, so I oversee operations that have to do with communications and engagement for our department. So just a little background on our department. So the county is just shy of 20,000 employees in total. If you chop those up into 4 buckets, if you will, those are our 4 business groups. The Health and Human Services Agency is the biggest of the 4. Coming in at about just under 8,000, or about 8,000 individuals in our Health and Human Services Agency. That's an integrated agencies. That's health, human services, also housing services. So within HHSA, behavioral health services is the 3rd largest department by personnel. And then the biggest department in terms of budget, we have a budget of over $1 billion for our local behavioral health services. So either substance use treatment disorder services and/or mental health services. So I know I'm kind of titrating down very quickly here, but so within that space of behavioral health services, I oversee any operations that are inward facing for our employees at behavioral health services, which is about 1,300 staff. And then externally with the community on any kind of topic. And so in terms of the day-to-day, there's certainly some administrative components throughout the day and the week, be those meetings with staff, supervisory meetings, update meetings, briefings, but then also certainly a set of meetings that are outward facing, connecting with the Amy's of the region, if you will, right? So I'm just thinking we have a couple different meetings set up this week to talk to a couple community members and providers. And that's pretty typical every week. It varies. Last week, I was at a state conference for suicide prevention for youth, suicide prevention and crisis response reporting. Don't have a conference every week, but that was just last week. It was fortunate. It was local in Carlsbad here. So, so we have that. later this week, we're actually going to be doing a data presentation out in the community on the latest trends on North County overdose, non-fatal and fatal overdoses and suicide, and self-harm in the emergency departments. So presenting data and then having a follow-up facilitated discussion with representatives from other organizations, different providers, to really kind of go, how do we fix this? What do we do with this latest data point? And how do we tailor it to North County? Because what North County is experiencing, it's not necessarily the same as what East County or South County is experiencing. And so that's just later this week. And then we are working on launching a new public messaging campaign to really kind of put more focus on not only that youth suicide prevention piece, but also our crisis response services here in San Diego County, whether that's our Access and Crisis Line, or our mobile crisis response teams, which is like a mobile team that goes out, to non-law enforcement team that helps in the event of a psychiatric or behavioral health emergency. And so being able to kind of do some public messaging, whether that's when you hear that, you might think either presentations and outreach, but also radio, TV, print advertisements, if you will. So again, it's different every week, but I think kind of touching all those pieces, I think if I had to boil it all down, and kind of overgeneralize, really at the end of the day, it's looking at how do we frame information, again, both for the staff that are conducting perhaps clinical services, but then how are we framing information, making it easier to access services if needed by the information we're putting out. And so I feel very privileged and, I have the pleasure of kind of overseeing those operations. And I do that in partnership with different organizations here in the region, as well as through different contracts and grants and such. So different every day.
Yeah, it's always a hard question to ask because it is very often different every day. But I think you gave our students a really good kind of overview. And it's funny because I don't think we've actually had a health promotions person on our panels in the past, at least in the past like 4 years. And so we always get questions about health promotion. So it's great for our students kind of hear sort of the different things that are available out there. The other funny thing is that every single year I have these panels where I'm trying really hard to make sure that we get different perspectives and people that don't know each other. But every single year we always have somebody where it's, oh yeah, I absolutely know that. Lauren remembers when she was on the panel before, it was someone that she knew was also doing digital health, even though it didn't actually, the description of their job was very different than hers. So it is always a joy to see how interconnected everybody is. And it's also something that's great for our students to know is that you're not going to necessarily only be doing one thing all the time, right? So often, we hear, oh, well, I'm not really sure if I can focus only on this. But it's always really nice to hear that there are multiple ways that you can kind of approach public health. All right, thank you so much. And Lauren, why don't you tell us a little bit about your day today?
Sure, I've been jotting down some notes, so don't mind me if I am looking down. Like the others, my days are very different from day to day and week to week. Working at such a small company, so basically I'm a scientist at a software company and I'm the only scientist, but I'm also I'm the only person that's working on regulatory affairs and one of the only people working on marketing. So I do a lot of different things. And one thing to call out is that I work across content areas and I'm working, the focus of our product is different than what I have studied in graduate school and ever done research on as an undergrad. So it's been really fun to see how my skills can be applied to lots of different areas. And I was thinking of that, Kat, because we're doing some studies with suicide prevention and with patients with opioid use disorder as well. And those are areas that I had zero exposure to, or very little exposure to. And certainly don't consider myself a content expert, but I am a methods expert. And so I can take those skills and apply them. So my primary responsibility is to lead our research. As a private industry company, it's really important to us to work with external collaborators to validate our product and show that it's evidence-based so that people don't think that we're just very biased and maybe messing with the results when we do all of our research internally. So I mostly work with academic partners. We love to work with government, but as a small company or early company, we haven't had that opportunity yet. So I'll meet with our partners who are doing studies of our product, and I will help them design the studies. I will help them with actually any technical troubleshooting. I'll help them understand and write protocols for how they can implement our product in the research. And then I'm always involved in helping them interpret the results. I have data analysis skills, but I don't do the data analysis in this role because it's really important to us that somebody outside does it, who doesn't work at the company and might not have that conflict of interest where they're trying to make money off of the product being safe and effective. I also oversee our research strategy and ensure that it's aligned with our business goals. So our product is actually considered a medical device by the FDA. And so we need to generate specific types of research evidence to present to the FDA. So I'm always looking at all the different studies that we're doing and seeing how they fit together to meet our business goals. And my meetings are both internal with other people at the company and external. I often take some of those technical problems from the partners and bring them to our data science team, our engineering, our product teams, and liaise. So it's a lot of communication skills kind of going back and forth between our internal team and external partners. I also work on identifying different grant opportunities and grant writing, and that was not something that I expected to continue doing after I left academia, but the federal government actually has a lot of funding available for small businesses that are committed to developing evidence-based products and bringing them to market. So that's been very fun too. As I mentioned, I'm one of the only people working on marketing. How do I work on marketing? I have a degree in public health. I review drafts that other people create and ensure that they're accurately representing the evidence that we have. And I also have really strong writing skills from my training. And so I do things like proofreading and copy editing, kind of just, we call it wearing a lot of different hats at a small company. And finally, I work with the chief product officer, as I mentioned in my intro, to kind of infuse some of that behavior change science into our products. So what does that mean? I'll look at prototypes that they've developed, I'll give feedback, and I also use those writing skills to generate content for our app. So, you know, writing simple articles about how your mood might be connected to your sleep and various things like that. And it's fun to translate the science. So as I mentioned, a mix of kind of meetings. In this role, when I do my technical work, I'm often on my own since I'm the only person doing my job at the company. And that's been a big change from the previous company I worked at. There were 20 people on the science team. And so I was doing a lot more collaboration and synergizing with other scientists. So it's been an adjustment. I have a lot of flexibility and autonomy working at home. What else do I do on a day-to-day basis? I try to get out for short walks during the day. And I do just love that flexibility of my job. I'm learning a lot and, you know, doing very exciting things, but also less exciting things because it's important that everybody just work together to get the job done.
Thank you. I always love to hear people's perspectives on teamwork in public health, because that's something that we very, very, very much have a focus on here. And so it's always great to hear multiple people talking about teams at once. All right, Kevin, can you share with us a little bit about your day-to-day?
Yeah, and there were so many jumping off points between what Amy, Kat, and Lauren were saying that I was like, oh, I'll start by talking about this. But maybe just because Lauren was the last person to talk, I'll just share also, because it sounds like you're working from home, Lauren, that I am also working from home. I have been teleworking for, I guess, the last 11 years from the Starship Enterprise, obviously. No, I'm actually in New Hampshire right now. I'm in the Boston area. So not far from the border with Massachusetts. And yeah, it's that part of work has changed a lot. Because since I've been teleworking for so long, at first it was all phone calls, and now we're using Microsoft Teams and Zoom, and I'm getting to see people all the time. So I think in public health, like in many other sectors, you'll see a real mix of opportunities to work both remotely, but also to work in person. And there really is a lot of opportunity to have that teamwork and that team building, regardless of which mode you're working in. So just a little bit about my day-to-day. So I am in a policy office. So I work for the policy division of the Bureau of Primary Healthcare, managing the health center program. And so I guess what I do is a little bit like what Lauren does as a scientist, but for me as a policy person / recovering attorney, which is I take a lot of other things that people are doing in our program, and then I tell them whether or not they're doing it in a way that aligns with what our law says we are or are not allowed to do, what our statute and our regulations and our other policy guidances say we aren't allowed to do. And then I do a lot of continuous quality improvement work. I work with my team on looking at the policy guidance we have out there, because most people aren't reading statute and regulations because they're really hard to read. Even if you are trained as an attorney, it's not something you want to do for fun. So we try to translate a lot of that into, I wouldn't say plain English, like plainer language, like a little bit plainer, but like our plain language scores are always not that great because it's still policy. But we translate it into things that people can use and that our grantees and health centers can use. And so where I sit doing sort of that public health administration / public health management piece of the work, I'm really working with more with other staff, and then I'm working with our grantees of our program. And I'm not really working as much day to day with folks in the community, the patients who are actually being served by the health centers that we're working with. I have been able to go on site a couple of times and do that site visit and see how the health centers are running. It's always been super rewarding. I love the program. I think we're doing amazing work, but I am really sitting sort of a few steps away in terms of the work that I'm doing. And so that has its pros and cons. I knew, like I said at the beginning, that I wanted to do civil rights work, and I transitioned it into policy work. So I am doing what I wanted to do. So to give folks who might be interested in policy or sort of the public health management administration side of things, to go back to what Amy was saying, I spend most of my day talking to people. It's just that I'm not necessarily talking to patients, right? I'm talking with other staff members. I'm in a lot of meetings where we're talking about policy documents, where we're talking about drafts, where we're talking about frequently asked question documents that we're putting out to the public, where we're talking about how the website looks. And we're talking a lot about these bills that are being proposed in Congress, and what does such and such representative or senator want to do in this bill, and how can we help them do the thing that they want to do in a way that actually is more aligned with what our program already does. So we're doing a lot of technical assistance work. So I think I won't go into like too much of the nitty gritty of the day-to-day, because I think it does vary a lot too. And like I said, I spend a lot of time meetings. I spend a lot of time writing and drafting documents and working with other people editing documents. So really just like writing and editing and going to meetings is a lot of my job, and thinking. I do a lot of thinking and a lot of research. But I'm putting that all out there, I guess, to say that it's not just the public health training that allows me to do my job right now. And I think you've heard that from some of the other panelists as well, which is I'm bringing a lot of the different skill sets that I have gotten from my undergrad, from my law degree, from my other work experience into what I'm doing now. And the other thing I'll share is that in my office, which is a policy office, I'm one of 2 attorneys. For a long time, I was the only attorney. We have people who have MSWs. We have other people who have MPHs. We have people who don't have any graduate degrees at all, right? And they came directly into the workforce and into the public health workforce out of undergrad. And they are all doing the same thing I'm doing. We're all bringing slightly different skill sets, and we all have slightly different roles, but we're all in the same policy office doing policy work. And actually the diversity of experiences and skill sets that we're bringing to the table is what makes it so valuable. So the other thing, I guess, advice I would give is don't worry too much about whether your degree is the quote unquote right degree or like the perfect degree for the job or the career that you want to have, because you can also grow into things and find ways um, to do the work that you want to do, even if it's not exactly sort of the cookie cutter way or like the way that most people would try to map out their careers. Like people, if I wanted to do the job right now and I was like advising my pass off, I wouldn't say go to law school because I don't need that degree. But at the same time, that training and those experiences I had working as an attorney have come in handy too. And there's some value added. So yeah, I spend a lot of time just talking to people, and we also spend a lot of time just, venting to each other about the things that we would like to be doing differently, which is also just a sign of a healthy, like, collegial environment.
Thank you. Yeah, I love your advice that so many people in your office are doing similar things. You don't have to have just one career goal or path. I think that's really valuable for our
Or
students.
degree,
Or
honestly,
degree,
or
yeah.
degree. Yeah.
Yeah, I think that we have so many students that worry that if they don't have exactly the career trajectory that they're supposed to, that they won't succeed. And I love hearing from people every single time that we do one of these. I hear so many of these stories. It's really, really helpful. So thank you. Can you tell us a little bit, Kevin, can you tell us a little bit about your like favorite parts? I know that we were talking about typical parts. Can you tell us like your favorite and your least favorite parts of what you do?
I love when I feel like something that I am doing is having an impact. I mean, I think for a lot of folks who are in public health, that's why we come to the profession, to the field. I think a lot of people in like service positions and roles and industries really want to feel like we're making an impact. And it doesn't happen every day, right? It doesn't happen most days. Um, I've had to, sometimes I worry a little bit about folks who are like, I'm really excited about policy, and then they get into a policy position. They're like, oh, policy takes a really long time. It can take years, right? I've had documents, policy documents that I've worked on for years. And sometimes at the end of years, they don't go anywhere. And we have a saying in my office that nothing is ever wasted, like it might be resurrected, several years down the road in some other form. But it can be really frustrating too. Um, but when I have the opportunity to do something, like I get to help shape a particular policy or answer a particular question, and I can actually pinpoint in my head the times when I've been able to give people guidance based on my understanding of the law and the statute and the regulations. And I've been able to say, you know what, we can tell these health centers, we can tell this particular health center who's asking us this question that they can absolutely do that. Or we can tell this health center that has a question about whether they shouldn't do something, no, you should do that. You should make sure you are providing your patients this particular type of care because you're obligated to. When I'm able to do those sorts of things, I feel really, really fantastic. And I can't speak about specific details, but I'm working on a policy right now that's moving faster than any policy that I've been worked on since I joined almost 14 years ago, because it's getting a lot of political support and a lot of support from the top, and it's just flying through. And it's just been really incredible to watch. And on the other end, I already know, because a lot of, the federal government is often catching up to people. We're not really innovating. We're seeing what other people are already doing a great job of doing. And we're saying, you know what, we should let people do that. But the fact that we're now catching up, and we're saying we're going to fund people to do this particular innovation, to work with this particular population that is incredibly marginalized and is not getting the sort of healthcare they need, and they're facing a lot of major disparities. And to know that I get to be a part of that and work on that policy document, that just, it makes me excited about going to work. It's really, really incredible. And my least favorite thing about my job is having to work with lawyers, which is funny because I'm a recovering lawyer. But yeah, those are the people who tell us, no, you can't do that. And that's less fun.
Thank you. Amy, can you answer the same question for us?
Funny, Kevin, I was going to say working with lawyers is my least favorite part of my job too, but no, just kidding. I think if I actually, can I start with the thing I like least? It's really, I will say it's the fact that public health has become politicized. That was not really a thing when I entered this field all those years ago. It wasn't controversial. And it is now. I've had a tough time sort of shifting my way of thinking around, community health initiatives. In my mind, they're a no-brainer, right? And I am frequently reminded by my district's council, by my board members, right, that community public health messaging, community health initiatives, there are some of them are like third rails, right, that we have to stay away from. And I don't know, that's just new to me, and I don't love it. But there's lots that I love about it. I think having been a social worker for so long, someone who was working directly with people, I went into their house, I sat down with them, and would do an assessment and make care plans, and I'd walk out having done several useful things for them, but in an hour. And I saw changes. I saw people's health improve, or it didn't, but I saw them have a good death. It was just very tangible. And public health is not always that way. As with policy, public health initiatives are also, it's a long arc, and you don't always get to see the end of it. But every now and then I do. I had an experience recently where my district grants scholarships to people that are pursuing healthcare careers. So note to all of you, if you live in East County or plan to work there someday, we give scholarships to high school students that plan to go on into health careers, but also to professionals that are pursuing post-secondary training and degrees in various health sciences. I had a couple of weeks ago, one of our high school scholarship recipients reach out to me. She had received a scholarship many years ago, is now in her second year of medical school at UCSD, and is super interested in she wants eventually to go into dermatology. She's very interested, though, in the community health sort of education side of melanoma risk reduction. And so she reached out to me with just wanting, she has an initiative in mind, a sun safety community health initiative in her hometown of Santee. Here in East County, and wanted to just sort of talk through can you give me some ideas on funding? Who do I need to talk to within, she wants to put in sunscreen dispensers in public parks and places where people get unexpectedly long sun exposure. And she just wanted to know, like, where can I get data? Who do I need to talk to? Can I have some money? Like all of those things. And it was such a joyful conversation. And I've been able to connect her to the city council and Parks and Rec and get her, in progress on some grant funding. And she's totally going to do it. And I'm going to see those sunscreen dispensers up in a matter of, maybe months, but probably like a year. But it's like a very tangible thing that we're doing. And it's totally full circle, right? Like we are very interested in supporting the healthcare workforce within my healthcare district. So seeing that investment kind of pay off a decade later is it's really a treat.
I love that. Thank you. Lauren, can you tell us about your favorite and least favorite things about your job? And then we'll go to Kat, and Kat, then I have a really meaty next question for you. So, Lauren?
Yes, of course. I'm going to start with least favorite too. And it's going back to something that Kevin mentioned. And you didn't frame it as a least favorite, but I got the sense that it was a little bit frustrating. You talked about sometimes the policies kind of sitting on a desk or not really going somewhere, getting stuck in the process. And I have to say, at the companies that I've worked at, there is very much a hurry up and wait. So the business priorities are always shifting, and things will be branded as an emergency, urgent, must do, and then they get stuck. And I didn't expect that, especially at a small company, that there would be bottlenecks, but there still are. And we have to take every opportunity that comes our way in terms of selling our product and advancing our business goals. So if something new comes down the pipeline tomorrow, it could mean that my last 2 weeks of work, that it's not wasted ever, but it goes on pause, and sometimes it can go on pause for many months, year, etc. So that can be pretty frustrating, but it's just a reality, and it can be I was gonna say it can be exciting to be changing gears all the time, but I'd say it's still my least favorite part. My favorite part is seeing the results of the studies that we do, and they can take anywhere from months to years, many years sometimes, to run. And so getting to interpret the data with our partners, even if it's contrary to what we hypothesized, there's always something to be learned. I think we can learn a lot from seeing what's not working with our product, how we aren't achieving what we set out to achieve, because it means that we can do better and we can make tweaks. I also, in addition to, I've talked mostly about clinical research, but I also run our user research. And so getting direct feedback from care providers that things that we're doing are actually improving their workflow, helping reduce burnout, and then of course from the patients and users themselves, that they're able to make changes in their mental health. It's very empowering.
Thank you. And Kat, same question for you.
Yeah, I mean, Lauren and Kevin and Amy, you already touched on a number of things that I could probably have hopped on as well. I think I'll do the same thing, least and then favorite. I think one of the more challenging things, and folks had kind of talked about this in different ways, right, is there's a lot of long game in public health. And so sometimes that can be, like if you are really like, oh, I want to see this come to fruition really quickly. Depending on what it is, it just might not be the case for several factors. I'll also add to kind of Amy's point earlier. I think same thing. The recent pandemic brought a lot of change, but in particular, I have never seen the field as politicized as it is today. And so while I appreciate the attention on our field, yeah, sometimes there are some things that I'm like, feel like that's simple, that should be simpler. But I will leave it there. And then I think just lastly, sometimes people take for granted sort of what goes into quote unquote coordinating, right? It's much easier to quantify. Again, I started more in the medical clinical health field, right? So it's much easier to say, what impact did I have today if I was still in the nursing profession and I gave how many vaccinations today, or if I gave, did how many assessments today with how many patients. It's much easier to quantify. And I think sometimes, a lot of public health, hopefully what's coming through is it's a lot of talking with others across sectors and building and maintaining relationships. And how do you really quantify the relationships you're building, right? Or how much time it took to kind of coordinate that big long-term project over several months or several years. And so I think sometimes folks who are maybe not as embedded in the field sort of are like, oh, so why wasn't that faster? Why did it take so long? Because there's sort of an overlook, if you will, on that, what goes into sort of that coordination and project management, if you will. In terms of my favorite thing, I actually have many. I think that's good since I'm in the field. But I think if I had to boil it down, I love making connections. Again, I really attach myself to sort of at my core education. And so when I hear about something that people didn't understand before, and we can figure out how to push it out or frame it in a way that suddenly they do get it. And not only do they get it, but maybe since they now get it, if they need help, they can get the help they need. Oh my God, that's like the best thing ever. But sometimes it's just even connections with people, right? Even in my own large organization, people be like, I had no idea that was going on. And I'm like, and maybe I know, and I will connect to those two folks, and we're able to do some collaborations in-house to have better cumulative collaborations that'll kind of serve our constituents. So making connections, the people, it comes down to the people. I have There's always one interview question I always like ask back to people that interview me now, at least for the last 5-6 years. And it's always, tell me a little bit more about the people, the projects, and the priorities for this position. Because those at the end of the day are things I care about. If I, who am I working with, serving, who am I working for? What am I going to get to dig my hands into? How can I contribute? What's important to them, and see if it aligns with what's important to me. But yeah, at the end of the day, you can't really do anything else without the people. And you're not the subject matter expert on everything. You're the SME on your stuff, and you work together with other folks around you to get stuff done. So, but yeah, I'll leave it there.
Thank you. And then I promised you a nice meaty question. So one of the things that, we always get questions about, since this is primarily, the audience is primarily undergraduates, one of the things that we always get questions about is, what did you do as an undergrad that you feel like prepared you for your career? What sorts of things didn't you do that you wish you had? Kind of how did what your undergrad experience was influence where you are, and what do you wish could have been different?
Yeah, I mean, I guess I'll take it a couple different ways. I think in terms of one thing I'm glad that I did, and again, this was probably in the last year, was feeling a little lost. I'm about to graduate, give or take. And so talking with not just my peers and other folks, see what they were going to be doing or what they were thinking of doing, but actually leveraging any, I didn't go to UCSD, so I don't know what's, maybe it's talking to you, Lisa, or others, but I don't know what the on-campus resources are, but kind of the Student Counseling Center or the Student Services Center was a huge resource. And one of the things that kind of the nuggets that to this day I recommend to any student, doesn't matter what level, is the value of an informational interview. And I never learned of that phrase, if you will, until I went to my local Student Services Counseling Center. And so I find that is a huge help because it's not like a job interview, if you will. It's sort of the reverse. And so perhaps some of the anxiety that might surround a interview for employment, I personally at least never found it to be there. It's a lot like tonight, right? Just connecting with folks and asking them more about, what do they do? Why do they do it? Really we're doing a informational interview just in a panel form tonight, in my opinion. And so, but I learned so much through that. I also got to network again in a less anxiety kind of riddled space. And I got to kind of open doors and see like, oh, I like what that person's doing. And is that what they did in terms of additional education, if you will? Was that required, or was that just by choice for that? So I think being able to kind of make those spaces to have those conversations with the folks. And people you'd be surprised. You'd really be surprised about how many people would just totally make time to have those opportunities. To take that time and talk to you. And I think in that summer of a million internships, I remember I kind of drafted up some language, said, I'm a senior in this undergrad program. I found your information online. I'd love to connect with you and learn just a little bit more what you do. And I must have sent that to 30 or 40 different contacts that I just kind of found. Most of them were kind of cold contacts, if you will, right? So I didn't have any prior connections, but sent it out. And for the kind of bites that I got back, I set up 30-minute or 1-hour interviews, whether that was a phone call, me visiting their location. And one of them was actually for my first boss at the county. So again, is it always going to be kind of that story? Not necessarily, but that was a huge one that I still to this day recommend. I don't know if I would have done anything differently. I think, in hindsight, I feel like in some way or another, I would have arrived at the same space. I look back and I think about what I really enjoyed when I was doing, when I thought I was going to do physical therapy or occupational therapy. I liked being able to teach someone to regain their, range of motion. When I was in more of a communication space, I liked being able to teach people through visual aids. And I feel like that desire to teach and have a broader impact later down the road, I think that still is in my, reflected in my current position. So I feel like I kind of lost a little bit of the question there, but I'll stop.
No, you didn't. I think that was great. And don't worry, we always have community members, not alumni. Excuse me.
Let's
Can I just build off of Kat a little bit. I'm also giving you the assist. Um, um, I really appreciate your answer. I really appreciate you talking about like the Summer of 1,000 internships. And I guess the advice I would give related to that is try to get work experience, try to get different work experiences. I think 3 different jobs when I was at UCSD, and I had 5 different work experiences when I was in law school. And you know, I tried to find things that were related to what I was interested in, and I tried to find things that gave me opportunities to interact with other people who I was interested in interacting with, and gave me a chance to build leadership skills, gave me a chance to build writing skills. Like Lawrence, you know, like I think everyone was saying, like writing, no matter where you end up working, you're gonna, you know, writing is gonna be an important skill for you. And when I am interviewing folks, I'm looking at their work experience, right? I'm not looking at their GPA. Like folks don't even list their GPA anymore in resumes. I'm looking at where did you work? What were you doing there? And then how are you tying that to what, you know, what I'm doing or what you would be doing if you were working with me. And like I was saying before, I and everyone I work with bring so many different diverse experiences to the table. And the last thing I'll say about that is just, you know, getting a lot of different work experiences. Like I have found that work experiences where you're actually getting to, you know, dig into something that is substantive as a student can sometimes be, and for me, a lot of times was even more valuable and even more educational than anything I learned in my classes. I still needed my classes. I still loved a lot of my classes. But just even, you know, doing 10 hours a week or 15 hours a week, being there in the office, seeing how things were done, learning how people talk to each other in meetings, how agendas are set, how conversations are set, how decisions are made. Those are all things you're not going to learn in the classroom. And also just then you can start to understand, here are the things that I like doing. Here are the things that I don't like doing. I want to find a job where I get to do more of this and less of that. So those are all really, really valuable experiences. I think kind of like Kat, I'm not sure I would change a lot about my undergrad experience, but I mean, maybe I would have tried to do even more different types of internships and other opportunities when I was an undergrad, just to get that sort of experience. And it doesn't have to be like these like super heavy full-time things, like you're just like in it all the time. You can find opportunities where people will let you work with them, you know, for several hours a week, 10 hours a week or something. And you can get a lot out of that. And I found, generally speaking, that folks who are willing to take interns or willing to take student workers tend to be the folks who are, you know, going to be super supportive and going to really want to make sure that you're having a good experience when you're there.
Thank you, Kevin, for that leftover cough. Amy, do you have anything to add?
Yeah, I'd say the thing that served me best in my undergrad, honestly, was just sort of I went in as a biochemistry major, and the decision to scrap that when I realized this is not me, and to really kind of dig deep and compare, you know, look at the reasons I was pursuing, you know, that career and why, and the pressures I was feeling, and just decided to be true to myself, and go in a totally different direction. I mean, you know, my decision to change my major from bioengineering to women's studies and sociology was not a huge hit with my family, as some people can probably relate. But man, was it the right thing for me. Studying those fields, I mean, it taught me how to look critically at social problems and how to see people and their environments in totally different ways, and just the thinking skills. I think the thing I would have done differently, I was a very serious student. I was very focused on you know, getting my work done and getting A's, and I worked a bunch of jobs. And my jobs, I think, kind of to what Kevin and Kat were saying, my jobs were just about you know, bringing in money and being able to pay off loans and you know, not accumulating too much debt. And I really wasn't thinking about the need to accumulate some relevant work experience. I really wish I had spent more time with my faculty, honestly, just like sitting in their office and talking to them about their research and what they do. I wish I had availed myself. Now, I really wish I had availed myself more of those really cool, interesting people that now I don't have a connection to anymore. And I'd love to get back in and pick their brains a little bit, but I don't have access to them anymore. So just take advantage of the people and the relationships that you can form. They will continue to serve you well, no matter what field you go into, and geographically, no matter where you end up. In this day and age, we can stay connected to everybody forever, for better or for worse. So I'm a big fan of collecting those relationships.
Thank you. Lauren, what about you in terms of what you did as an undergrad or what you would have liked to do?
Yeah, I'll try to be brief. I had some thoughts, but then Amy brought up something else that I think will resonate with several folks who might be listening now or later. So I mentioned in my intro that my first class was Intro to Community Health, and I never looked back, but I thought at the beginning that I was pre-med, and I was fine with bio, I was fine with chem. I really struggled with physics, and I just took a look at my priorities, at the things that I was enjoying, the classes that I was most enjoying, as Amy was alluding to as well. And it's not that public health was never second choice to me. It became a very clear first choice. But in reality, also, there was something about the pre-med track that was difficult for me. And I know that sometimes people think that some public health people are just people who couldn't make it to medical school or through those requirements, and they're totally distinct, but they work together. So if you are somebody who was pre-med and is not anymore, you're not sure anymore, rest assured that pretty much all of us on this call, I'm sure, interact with direct care providers and medical professionals and doctors all the time. So you're not totally out of that. There are lots of different ways to contribute. And then the other thing, so just being open-minded, and then about getting a lot of diverse experiences. So I took pretty much every research opportunity that came my way that I could fit into my schedule. I spent a semester working with rats and very quickly learned that I'd rather stick to humans, but just taking advantage of everything that I could, and all of those experiences helped me get several job offers right out of school, because they saw that I had experience. I learned things about working in an office, showing up, being reliable, interacting with other people in professional environments, and that was totally invaluable. And then just on, I think Kat, were you talking about the networking, the informational interviews? So
I think Kevin also.
Kevin also,
like
yeah,
a lot of us.
and Amy, you were talking about connections and relationships too. So I didn't do as much of that, I think, in undergrad, but certainly in my most recent job search when I was graduating from UCSD. I think part of that is the many years later, the rise of LinkedIn, and the ability to connect with people online. I did so much informational interviewing in my last year of graduate school. And it's so much easier to do that, and so much less pressure for everybody involved if you're not actively looking for a job. So if you are, that's okay too. I find it can be helpful to be transparent, and not pretend that you're not, but it's much more fun when you're just truly exploring. And I'd say always follow up with the people that you connect with, and ask them if there's anybody in their network that they can connect you to. And that's how you start building the web.
I love that. That's a great piece of advice. Thank you. And the very last question that I have right now, and then of course we'll open it up to our participants, is for any of you, If you are doing hiring for people in positions around you, right? Not necessarily your position, but positions around you, what are things that our students could do to stand out in a good way? What are things that they should avoid doing? What sorts of things are you looking for a potential hire? You can just jump in.
Yeah, make sure that you've looked at our website. I mean, make sure that you've done some reading and some research. I can't tell you the number of times when people show up and they don't, I mean, they're referring to the office or the parts of our agency with the wrong names. And it's just very clear that they're not, they might know about sort of the larger Department of Health and Human Services, but they're not really, everything they're saying shows that they don't actually know about the program that they're applying for. So just be prepared. And actually, the other part of that is don't apply to jobs that you're not actually interested in. Like, just make sure that, you're, and then I think that, like Kat said, the informational interviews is just a great way to do that. Just really, even before jobs are posted, go out there, talk to folks, get a sense of what the different jobs are. For somebody applying for a policy position, it's really important to take either what you've learned, course material, but especially work experience, and be able to say, even though this may not have been policy work the way that you're doing it, here's the way that I see connections. I see connections because I have really good writing skills, right? I have connections because I, had a lot of chances to engage in teamwork and work on team projects together. And like, a question we often ask folks is like, give us an example of a time you had to work in a team that you weren't leading, right? You weren't the official supervisor of the team. What was your role in that team, and what was the problem that you had to overcome, and what were the results of that? So I think there's a lot you can do in terms of just thinking through how your own experience, whether or not you have a lot of work experience, can apply to the position and the position description.
I'd say a couple of things. I find thank you notes actually very professional, and I'm surprised. I've been doing them for many years, but I'm surprised at the number of people that don't. So that can definitely help you stand out in my eyes. I'd also say proofreading your materials. If I'm busy and have a big stack of resumes and one has a bunch of errors, I just might think that person is not as thoughtful and detail oriented, which especially for positions coming out of college in my field often are dealing with a lot of details. And so that's an important skill. And then I'd also just say practice interviews and polish with interviewing. I know it's not a natural skill for most of us, but the Career Center has many different resources. You can use your friends, but I encourage you to also do mock interviews with people you don't know.
I'll go. I think in my last few bits of hiring that I've done, something that really stood out it sounds so simple, but just following the instructions, right? Like reading everything and doing all of the things that the organization asked in the order in which they ask it. We're not doing that. At least I wasn't doing that to try to trip anybody up or make it difficult. But it really shows your hiring manager what kind of a team member you're going to be. That I've taken in all the information, I listened, and I can follow this sequence of instructions. It goes a super long way. But in terms of the kind of person that I'm looking for in a public health professional, this is knowledge work, right? For the most part, there are some hands-on types of public health work, but I think, and what most of us on this panel are doing, it's knowledge work. And I'm not hiring looking for someone that knows everything they need to know about this. I'm hiring looking for people who have humility about what they don't know and curiosity, and good critical thinking skills and research skills, and an interest in finding the answers. I don't need a candidate to tell me everything they know about a particular health issue, but I want to hear why they care about that issue and how they might go about finding out more if they don't know about that issue.
Right, and I'll slip in here and try to be quick. I was like, just talk about this one. There's so many. I feel like I've been hiring for like the last 2 years. Straight. My team is a newer. We had a reorganization. We're still having a reorganization as a department, and so we have been fortunate enough to be growing our team, and so there's a little truth in I've been hiring the last 2 years. I'm hiring now, but just to piggyback off of everyone else, I think the 2 or 3 things I'll just quickly mention is, please don't take yourself out of the running before you've even started the race, if you will, right? I hear so often about people, last minute I decided I wasn't going to apply because I just, for XYZ reason, either they read those minimum qualifications and were like, I don't know about this one and this one, so I didn't meet them, so I shouldn't apply because I'm not even going to get looked at, right? I can't tell you how many people that I've heard, or maybe I kind of knew of them, maybe peripherally, and then I find out that they didn't even want to apply. I'm like, oh my God, you would have been one of my top people I would have wanted to at least see for an interview had there been a application for me to consider, a resume for me to consider. So I cannot stress enough the importance of, and sometimes it's hard, right? That is really hard to be like, ugh, I think I have what it takes. I'm going to put it in there, right? And so I think coupled with that, I would just add, don't place more pressure on that action than necessary. And what I'm trying to say by that is, for us, some so often, and we have a very unique system at the county, probably similar to what Kevin has since he's also government. But like, you got to make certain eligibility lists. And then if you don't even make that list, then you can't even be considered. We're not the only, that's not the only sector that leverages a system like that. But I will see so many people they'll write their application as if they're writing it for the interview. You just need to get that first step of making the list. And so again, it's kind of very unique to kind of our hiring protocols, if you will, but don't put so much pressure and be thinking, oh, you need to answer every single thing that they're possibly going to ask you in this hypothetical interview that you haven't even had yet, right? Like, don't put that pressure on yourself. It's already stressful enough. And don't take yourself out of the running. We know what we're looking to hire, right? I was listening to my colleagues here and I was just thinking, I usually know what I'm looking for. We'll have whatever questions. I think the hardest part, especially for those who are on, who might be younger because it's undergrad, right? There's a level of self-awareness that just comes with life. So sometimes that's really hard to like have that, right? I think, but that's the biggest thing, because that can come across so well or not in interviews, right? When someone can speak and you can tell they are really confident in what they are strong at and their skills and their strengths. And a lot of that is just, you've gotten to try out and apply those skills more, and you've got that life experience and that, but I don't want you to go like, well, I can't live 5 extra years, Kat, right? So I'm trying to kind of balance this here, but I think placing more focus on, what are your transferable skills and seeing them as transferable skills. And if you've never heard of that phrase, please Google transferable skills, right? I can't tell you how many people I have met where they took themselves out of the running because like, nope, I worked in this industry that would never translate and transfer. And then if I were to read their resume, like, actually, you did that with those stakeholders? Wow, you must be really detail oriented and manage yourself, your time really well. I can see that in your resume and your application, right? So don't worry about saying it a certain way. Like, I'm probably going to get that as the hiring manager. I just need you to be able to articulate that, and be confident in what you feel strong in. And I think you need to just get out and try more things to figure out what you're strong in. So, but at least I'll pass it back to you. It was really long. Sorry.
No, you do not have to apologize. That was great. And in fact, so much of what has been said tonight are things that we are consistently saying to our students. So I love that. I think students, if you do have questions about informational interviews or interviews in general or transferable skills, etc., you can always talk with us as advisors, or you can talk with the Career Center because they really are the experts in these matters. just in the last couple of minutes, I don't know whether we have any student questions. I know that it looks like most of our students are really going to be viewing this after the fact, so we may not have any, but if you do have a question and you're a student, please go ahead and pop it into the chat now. We'll give that a minute or two, see if anyone's got anything.
Kat, can I ask you a question while we're waiting to see if any of the students have questions? So I know with the federal government, there's occasionally different agencies that do trainings for how to navigate USA Jobs, which, by the way, if you're looking for a federal job, usajobs.gov is the federal job search website. And it's a special skill to know how to use USA Jobs. It's a special skill to know how to fill out a federal job. So I think recently the US Forestry Service had a webinar. You can just Google like how to do a USA Jobs, how to apply for a federal job. And you'll occasionally see some of these trainings. Do you at the county do those sorts of trainings for folks?
To a degree, yeah, I was actually gonna say, I know, so we have what we call our youth sector. And so a huge component, it's not the only focus they have, but it's on making sure that local youth and young adults understand the opportunities at the county when it comes to career exploration and employment. And then I'll also say, I personally, my team and myself, we will do presentations and we will walk you through, this is how to navigate. So locally, it's governmentjobs.com is the one where you see a lot of local agencies, so local counties like ours here in San Diego County. Because yeah, it's not intuitive, you know, and oftentimes it is very time sensitive, because there are certain openings, and once it opens and it closes, again, that was the window. And so often people are like, oh, I would have, right, but I didn't know that was open. And so I don't want to take away from any time for student questions, but I will put the shameless plug. I actually made 2 friends on here, looks like, by the names, on LinkedIn already. So please reach out to me on LinkedIn. I'm happy to be that navigator. Again, I started as first an unpaid student at the county, and then a paid student, and then you know, fast forward a decade, now I'm where I'm at. But we're going to be hiring soon. We've got 3 graduates who will be graduating in May, and we like to fill behind them. And it takes 3 to 4 months, if you can believe it, to kind of go through because of our government processes. And so even though we're tentatively having new students start in July, our recruitment is actually opening in the next week or so. And so I'll be posting about that on my LinkedIn. I'm happy to provide that to Elisa as well for UCSD for any place that might be appropriate to post. But I will tell you, we run our student interviews and our student recruitment process as closely as we can to a permanent hire process, to give that, to sort of illustrate that example for prospective hires at the county. So I can't say that of all of my colleagues. Again, we're a very large organization, but it is really difficult to navigate sometimes. And I've found that kind of that extra time and you know, work in the front, if you will, on our part administratively has really netted out some amazing team members. That's more than worth it for me. So again, would be happy to connect with anyone. And I know, like I said, few folks have found me on LinkedIn, so look forward to speaking further with them.
That's perfect. Thank you. I'm not seeing any questions in the chat, which is totally fine. But Kat, definitely please do send me that posting, because I know that our students would love to hear it. And students, just a reminder, there will be, you have received in your email already, and there will be a post on our website with the information about each of our panelists. Please do go ahead and find them on LinkedIn or in various places that they have said, yes, please contact me. We would love for you to make some new connections. To our panelists, I just want to say thank you so much. I know that it's not the easiest thing to be here till 7 p.m. / almost 10 p.m. for you, Kevin. So thank you. And I always learn so much from these. I really appreciate you being here. I know our students do as well. And I hope that we can continue to work with you in the future. So thank you so much. And it looks like we've got a thank you in the chat also from our students. So, and
Well,
for students, don't forget, this will be posted on our website at some point in the next week. All right. Thank you.
Thanks.
Thanks
Great to
very
meet you
very
all.
much.
Thank you so
Bye.
much.
Thank you.
Good night.
Bye. Have a great night.